Hi, my name is Chandler Clark. I am a nursing student at the University of South Alabama, and this is my medication administration checkoff video. Here is my photo ID and my room scan. Okay, so first I'm going to start off by saying that when preparing medication, you should ensure that it is an interruption-free place. So when I am preparing my medication, I will close the door, I will not be taking any phone calls, and I would minimize any communication with my colleagues unless it's super important. If my agency had a no interruption policy, I would be following that policy for medication preparation. So now I can get my order and my MAR, and I am going to compare them. So I have Mr. Jaguar J. Jones, medical record number 4176352, 4176352. And my order, and he is allergic to penicillin, which is on both the order and the MAR. My order is for Novolin R regular insulin, unit 100 insulin, and my order is for Novolin R regular insulin, unit 100 insulin. I am administering 10 units subcutaneously, 30 minutes before meals. Okay, so that means that I do have the right medication, the right dose, and the right route, and this is the right time because he has not had his insulin and it is a little before 30 minutes before his meal. It is the right indication. He does have diabetes, so he needs insulin for his blood glucose. And I will not be doing any documentation yet. I will be doing my documentation after I have administered his medication. So now I can put this to the side, and now I'm going to take my MAR into the medication preparation room. I'm going to do my hand hygiene, and now I'm going to grab my vial for my medication and do my first check for accuracy. So I have Novolin R regular insulin, unit 100 insulin. Okay, so this is Novolin R regular insulin, unit 100, and it expires in December 2025. Here is my vial. So it is Novolin R regular insulin, unit 100, and the expiration date is 12/1/2025, 800. So it's not expired, it is the correct medication, so I can use it. And it is the correct indication. Mr. Jones does need insulin for his diabetes, and he does need it 30 minutes before his meals, so that it can help with his blood glucose. And I would check with another nurse to make sure that my dosage is correct and that I will be administering 10 units of Novolin R regular insulin. So after I've checked with a nurse, before I check with the nurse, I would continue my other rights. I wouldn't be documenting until after I've administered the medication, and this is a medication that is administered subcutaneously. So I would get a insulin syringe. These are in units, which I am administering 10 units. This is the perfect syringe. It is meant for insulin. And it is a subcutaneous injection. So now I am going to go ahead and I would then verify with a nurse, another nurse, that is the correct dosage and medication. So then I will take my alcohol swab and I will clean my vial. Then I will take my syringe and I will remove the cap, and I will go ahead and draw 10 units of air. And here it is. 10 units. So now I can inject that into my vial. And then I'll flip the vial and draw my medication. And I will draw until there's no bubbles of any kind, and it's exactly at 10 units. So I have 10 units of insulin. And now I'm going to put the safety cap up. I'm not going to twist it though, so that I can administer it later. And now I'm going to do my next check for accuracy. So I have my syringe and my vial. I did draw from my Novolin R regular insulin, unit 100, and I did draw 10 units. And this is going to be injected subcutaneously, which this is the correct indication. He does need insulin for his diabetes. Insulin is injected subcutaneously. And it is the right time, 30 minutes before his meal. He has not had it yet, and it is about to be 30 minutes before his meal. And now I would not document until after I've administered the medication. I will double check with a nurse to make sure that that is the correct dosage and medication. And now I'm going to go ahead and do my label, making sure it is the right patient, and label my syringe. So I'm going to write Jaguar J. Jones, and this is 10 units, Novolin R regular insulin, unit 100. Okay, so now that I've made my label, I do have the correct name and the correct medication on my label. I'm going to put it on my syringe. So here's my labeled syringe, and I do have 10 units. I have double checked with another nurse that I do have the correct dose, and I have covered all of my rights. So now I can go ahead and take my vial, my syringe, and my MAR into my patient's room. So, I'm going to go to Mr. Jones's room. I'm going to do my hand hygiene, and I'm going to make sure I have the right patient. So, Jaguar J. Jones, medical record number 1476352, 1476352, and he does have an allergy to penicillin, and he does have that bracelet. And now I am going to assess his blood glucose level, make sure that I should be administering this insulin, and now I am going to do the rest of my rights. So I am going to look at my vial and my syringe. I have Novolin R regular insulin, and that is what is on my MAR, and I have 10 units in my syringe. 10 units is the dose. I will be administering this subcutaneously 30 minutes before his meal, and it is 30 minutes before his meal now. It is 1600 right now, So when I document, I will say that I administered at 1600. So I have my right medication, my right patient, my right dose, my right time, my right indication. He is diabetic, so he does need insulin. And now I am going to document after I administer his medication, and I have the right time. So now I am going to go ahead and lower his bed and lower the side rail, or raise his bed, lower the side rail, and I am going to go ahead and put my gloves and goggles on. So I have chosen to do the abdomen for his subcutaneous injection. My goggles are on. And I chose the abdomen. I'm coming to this side because there's lots of spots for injections. You can go anywhere 2 inches away from the umbilicus, in between the costal margins and the pubic area. So there's a lot of areas that I could be using for the subcutaneous injection. So now I'm going to put my syringe down. I'm going to grab my alcohol prep wipe, and I'm going to wipe in circular motions. Now I'm going to take my syringe and go ahead and take down that safety, and I'm going to pinch 1 inch of skin and inject at a 45-degree angle and slowly inject the medication. Alright, and I will not be massaging it or putting any pressure on it. So I just raise the safety of my syringe, and now I am going to go ahead and get Mr. Jones into a comfortable position, lower his bed, cover him with his gown again, raise the side rail, and then I'm going to put my syringe into my sharps bin. Now I can take off my gloves and do my hand hygiene, and then I will go and document for my assessment, which was his blood glucose level, and then I would also document my medication. So I administered Novolin R, regular insulin, unit 100. I administered 10 units subcutaneously in his abdomen 30 minutes before his meal. And I would include the time and the date, so it is 16:30, October 4th, and I would also document if he experienced any reaction or response to the administration of his insulin. So now I am done with my medication administration video.